Okay, and we should be live. Hi, everyone. Welcome to another virtual session with Dental Shadowers. We're thrilled to welcome Dr. Asaro, a general and cosmetic dentist out of Los Angeles. Dr. Asaro, thank you so much for taking the time to meet with us. The floor is yours whenever you're ready.
Awesome. Thank you so much for having me, guys. I think this is a really great idea, especially with the pandemic going on. I know it's not easy to get into a dental office and shadow. And I know that that's something that's really important when admissions committees are kind of, evaluating your application and deciding who they should accept. I think they definitely, they weigh very heavily on shadowing. So I think this is a great idea. You guys are, making the most of what you can. And I think this is a really cool way for you guys to connect and listen to different people from all over the country and, do it in a safe manner. So let me just jump right in. Tell you guys a little bit about my journey and how I got here. So when I was in high school, I grew up in New Jersey. So I went to a marine high school. So I was always very interested in science. I didn't really know exactly what it was that I wanted to do in terms of my career, but I knew that I loved science. And then as I started to get towards like the end of high school, early college, I was really interested in medicine, and I thought that I wanted to become a plastic surgeon. So as I was, continued to be interested in healthcare, and I started to take kind of the biology pre-med route in early college, I was really influenced by a friend of mine whose parents were both dentists, and they kind of, influenced me to shadow them at their office and get an idea of, the differences between medicine and dentistry, and how there are some really nice things about dentistry that, you don't get with medicine. So that led me to apply to this program at UMDNJ in New Jersey, which is now known as Rutgers. And it's called the Gateway to Dentistry program. And now I don't know if they're still doing it because of COVID, but I believe there's various programs like this throughout the country, and they're designed for pre-dental students to basically get exposed to all the different aspects of dental school and all the different specialties, and just kind of learn about, what does being a dentist entail, and is this career something that I would enjoy, something that I want to pursue. So that was kind of like the big turning point for me. That was kind of when I was really motivated, and I was really sure of me wanting to go and apply to dental school. So again, I went to TCNJ, which was the College of New Jersey, and a very, very strong science school. And I was a biology major. And so I basically applied to dental school during my senior year, I believe it was. And NYU Dental School is where I decided to go once I got accepted. So I went straight from undergrad into dental school. And then, at NYU, that was kind of where I was first exposed to aesthetic dentistry, and that was kind of what most interested me, and that was kind of where I was, gravitated towards. And so during your fourth year at NYU, you have the opportunity to choose, you apply to one of, many different honors programs. So you can apply to like ortho, or you could apply to implants or oral surgery. So I applied to be in the honors aesthetics program, and it was an excellent program. I had the opportunity to do multiple like smile makeover cases during my fourth year, which is pretty rare for a dental student. So I felt really grateful that I was, I had a very kind of specialized fourth year at NYU, and competed in the national poster competition at the American Academy of Cosmetic Dentistry. Actually, one of the cases I'm going to go over with you guys today was one of the cases I did as a fourth year as a part of this program. And I decided to use that case mainly because the documentation is just so much better than like nowadays when I'm in private practice. I'm taking photos, and I'm communicating with my laboratory and my ceramist, but I'm not like creating, these like presentation type formats on a daily basis for my cases. So I just think that it'll be nice to kind of share with you guys the presentation that I had put together when I was a fourth year student, because I presented it to the first year dental students, and it was only 4 years ago. So I hope you guys will enjoy it.
Yeah, awesome.
Yeah. So upon graduation from NYU, I decided to do a 1-year GPR program at USC. So GPR stands for General Practice Residency. And, in New York, it's required that you do a 1-year program in order to get your New York state license. In most states, it's not required to do a 1-year program. But I think if you talk to a lot of older dentists and ask them their opinion, they'll tell you that doing that extra year of advanced training is very worthwhile, and you get a lot of really great experience, and it's kind of another year to work under the supervision and get some really excellent training and some procedures that you might not have been exposed to in dental school. Because in dental school, you're truly exposed to the bare minimum. You're by no means a great dentist when you graduate from dental school. So doing that extra year, in my opinion, it's worth it. I'm happy I did it. I got exposed to a lot of procedures that I would have never, otherwise been exposed to. And then, it also looks a lot better when you're applying for like associateship positions. So I highly recommend it. A lot of people are always asking me my thoughts on doing a GPR or an AEGD. And I say go for it. I really can only speak on the program that I went to, which was here at USC. But I know that a lot of different programs are very different depending on what it is you're interested in. You can get much different experiences at different hospitals that you work at. So then when I finished the program, then I started working in private practice as an associate, and I did that for about 2 years. And then just about 4.5 months ago, I purchased my first practice. So now I am a practice owner. So what is cosmetic dentistry? So every dentist should be a cosmetic dentist, because anytime that even if we're doing, a filling on a back tooth, we should be striving to make the restoration aesthetic. So we should always be trying to mimic nature to make the restoration look like a tooth. That means, matching the color, matching the correct anatomy, the correct form of the teeth. And, every dentist should be always seeking to be a cosmetic dentist. Now, a lot of dentists, especially general dentists, love to refer to themselves as cosmetic dentists. And that's because any general dentist can refer to themselves as a cosmetic dentist. But when I refer to cosmetic dentistry, what I'm talking about is when someone comes into the office and they're seeking to do an elective procedure to improve the aesthetic of their smile. So, elective procedure means that they don't need to have their teeth restored because of cavities or because of, any type of defects that they have going on or any type of active disease process. They're simply trying to improve the way that their smile looks. And, this kind of specialty of dentistry is very fun because you have the opportunity to not only change the way that someone looks and feels, but really help them build confidence, and it's incredible how a new smile can change the way that somebody looks and feels, and the way that it can give them new confidence to maybe pursue a new career or to get out of a toxic relationship or whatever it may be. It's really powerful what cosmetic dentistry is capable of. Cosmetic dentistry is probably the least invasive way for somebody to look and feel younger. So I wrote here that, to be a really good cosmetic dentist, I believe you have to understand art, you have to understand symmetry, you have to have a firm understanding of facial features. And I think you also have to have an idea of beauty and of what looks good, because what looks good to you might not look good to me, or what looks good to me might not look good to you, right? So, beauty is something that's subjective. So that's why when you see different cosmetic dentists, you kind of see different dentists have different aesthetic. So they have different styles. So they prefer to make the teeth look a certain way because that's what they think looks great. And that's the beauty of cosmetic dentistry, is that you really can kind of make your own personal like flair, your own personal aesthetic with the cases that you're doing. So my advice for college for you guys, it's pretty simple. Just study, 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 and don't party. Or maybe party a little bit, but study and study, because I'm sure you guys already know this, that the admissions committees, they look at the numbers. And so in order to even be considered, you have to have a certain GPA and you have to have a certain DAT score. So I don't really have any other advice besides that. I know you can do basically any major you want and go to dental school. A lot of people decide to do a major and then do a postgraduate program and then apply to dental school. So there's a million different routes you can take to go into dentistry. But I think you guys are already aware that you need to do the prerequisites. You need to do all the sciences, the organic chemistries, and the physics. And I'm sure there's people who are better than I who can kind of give better advice. But that's like the main advice. I just want to kind of.
Yeah, I think those are two foundational points to success in undergrad. So.
Yeah, for sure. But also have some fun too. Don't be all work and no play, because I think life is about balance. And I think at least in my experience, the kids that were the most successful in dental school were the ones who created a little bit of balance for themselves, because if not, you can kind of go a little crazy. So a typical day for me, so I wake up, I put this kind of as a little bit of a joke, but I recently found a little trampoline on the street when I was running, and I've been jumping on it in the morning, because I don't know if you guys have seen Tony Robbins before, but he jumps on a trampoline in the morning, and it's apparently very good for your body. It gets like your lymph system, flowing, and
I love it.
So I like to do that. That's like literally a week. I got started doing that a week ago. So I like to meditate. I like to read a little bit. I get dressed. I have some coffee. I get ready for work. And in terms of like my day at the office, I prefer to do my big cases in the morning, just because 8 a.m. I'm fresh. I haven't seen any other patients. I'm kind of I'm focused. I'm in the zone. And then I like to do my consultations after lunch. And then, my practice is a comprehensive general dental office. So typically I'm performing procedures like most general dentists. So I'm doing restorative fillings, crowns, bridges, veneers. I do extractions, I place implants, and I do a lot of Invisalign. So I think the beauty of being a general dentist is that you have so many different procedures. There's so many different things that you can do, that you can pursue, and no day is the same. So I know some specialists, people go into specialty because they prefer to do just that thing. And then, my take on it is that being a general dentist, you kind of get the best of both worlds, because you can truly, if you really only want to do, let's say, ortho, if you really want to just do ortho and you're a general dentist, you can take a bunch of continuing education courses and learn how to do bracket and wire ortho, and you can learn how to do excellent Invisalign, and you can kind of create a niche practice, and you're not technically a specialist, but you're doing a lot of ortho. So that's kind of the beauty of dentistry, is that you can really go with whatever path you are most interested in, and whatever path you want to go towards, you can do it. You can go into private practice like I did, or you can go into education, you can go into research, you can go into military. There's just so many different avenues that you can take in dentistry. So it's one of the reasons why I think it's such a great career. What kinds of complaints do patients present with? So most patients of mine who are seeking cosmetic dental treatment are just, unhappy with their smile for one reason or another. Sometimes maybe they're older and their smile has suffered, the typical wear and tear that comes with life, and they're looking for kind of like a rejuvenation. And in my opinion, being a good dentist is more than just having the knowledge and technical skill. So I tell my staff this, and this really is the truth. Dentistry is a people business. So, if you like people, then you'll be good with dentistry because you're working with people on a daily basis. Like, for better or for worse, during this pandemic, it became kind of clear, how much of a people business dentistry really is. Like, yes, there's virtual consultations, and now there's teledentistry, which can only do so much, right? But 95% of my friends who aren't in dentistry are working from home, but that's just not an option for me as a dentist. So for better or for worse, dentistry is a people business. So I like people, I like interacting with people, I like meeting new people. So that's why I like dentistry. But, I think you need to ask yourself, are you a people person? And if the answer is yes, then dentistry is probably a good career for you. So I tell my staff that, we're not in the dental business. We are in the people business, and we are providing dental services. So, being able to listen and connect with the person is paramount. And so my goal when I'm treating someone is to help them achieve the smile of their dreams. So I think one of the pitfalls that a lot of dentists run into is that, they kind of try to push their own agenda or their own opinion on their patient, and that's not the right thing to do. Granted, a lot of patients do kind of ask for my opinion because, this is something I do every day, and I'm happy to give them my opinion. But at the end of the day, this is their smile. This is going to be something that they're going to have in their mouth for, the next 15 to 25 years. And so my goal is to make them happy and to make them feel confident and to make them, feel comfortable smiling. So I think it's always a good reminder to always remember that. So my consultations with my new patients who are coming in looking for, aesthetic enhancements, this is kind of how it goes. So first, I sit with them and I talk to them, and that's it. I try to connect with them. I try to match their tone level, and I listen. And I ask them some questions. Once I finish listening to them, I ask them a few questions, and the goal is to kind of elicit an emotional response. So, how would getting the smile of your dreams, how would that make you feel? How would it affect you? It's nice to hear how this treatment is going to improve the quality of their life. So after I kind of sit with them and listen and just talk to them and get an idea of what it is they want, then we do a full photo series in the office. So digital photography is extremely important, especially in aesthetic dentistry. So we do photos of the teeth, we do photos of the smile, and then we do photos of the face. So after the whole photo series is done, then we do a comprehensive exam. So that includes like a full mouth series of X-rays, and we go through the X-rays together. I put the X-rays up on the television screen. We go through them together. I answer any questions they may have. I explain to them that doing aesthetic dentistry is kind of like putting the beautiful finishing touches on a house, right? So you're never gonna put a beautiful paint job on dirty walls, right? So it's the same thing with the mouth. The health of the mouth, the health of the gums, the foundation of the mouth is the most important thing, because if they have no foundation, then they're not a candidate for cosmetic treatment. So we check the health of their mouth and make sure that they're indeed a candidate, make sure they don't have any problems with their joints, make sure they don't have any, muscle or jaw pain. And once we do the comprehensive exam includes an OCS, or oral cancer screening. So every new patient that comes into my practice gets an oral cancer screening, and it consists of an extraoral and an intraoral exam. So we palpate the lymph nodes, we check the joints, we check the submandibular and the sublingual regions, and we check the floor of the mouth, the pharynx, the soft tissue. And after we do the exam and we check the health of the mouth, then I put all the photos that I've taken with the patient and I put them onto an iPad, and then I use the Apple Pencil and I kind of draw a digital design of where I'm proposing that we could bring the patient, and this kind of gives them like a visual idea of my vision for them and where I think that we could bring them. And then I discuss the process. I talk about how the process of getting veneers works, and the timeline, and we talk about the cost, and that's basically it.
That's awesome. I feel like when you include the patient in this in the process at such a level, you're essentially giving them ownership of their smile. So that's
yeah.
Thank you for
Absolutely.
sharing and illuminating that.
Of course. I'm gonna go to the other presentation. Tell me if you guys can see this. Okay.
Yeah, looks good.
Okay.
Perfect.
Is that good? Is that good?
Yeah.
Okay. So consciously or unconsciously, people form opinions about you based on the way your smile looks. A great smile is essential support for the entire facial structure. Start thinking of yourselves as orofacial experts. So again, this was a presentation I gave to the first year dental students at NYU when I was a fourth year. So I'm going to kind of run through it rather quickly just because it's kind of long. But here are two cases that I did when I was a fourth year. So this patient presented with no significant medical history, and kind of main chief complaint of all of my teeth are different colors, and I really want a beautiful smile. So here's a close-up shot of her smile. As you can see, there's some staining, there's some old restorations in between the teeth that are rather yellow, and there's some chipping of this bonding that was done on the front tooth. The angulations of the teeth are kind of off. Here's a retracted view. You can see that she has some just kind of a mishmash of colors and shapes here. So another close-up shot. You can see this bonding that's discolored and kind of chipped, and it doesn't look very flush, and it's a little distracting. So this is the right shot. This is a bridge that she has from tooth number 4 through 6. And here's the left side. You can see those are fillings in between the teeth that are really yellow. So the thing about composite is that it's a porous material, so it takes in stain as time goes on. And so we all drink coffee and we drink red wine, and some people smoke, and so these types of things, they can discolor the composite. Whereas the nice thing about porcelain is that it doesn't stain because it's non-porous. So here's kind of occlusal shots of her mouth. So you can see she has a lot of dental work that's been done, but overall she has healthy gums. She's, for a 70-year-old, she's not missing any teeth. So she's in pretty good shape. Well, she was missing teeth, but she had a few implants on the lower right and lower left. Here's her x-rays. I'm guessing you guys, at this point, probably this doesn't really mean much to you, but these are very important. So the first thing we do is after we do an examination of the health, we do a facial analysis. So we look at, the midline of the face. How does the midline of the face coincide with the midline of the teeth? We look at the interpupillary line. We look at the commissural line, and we want these lines to be, parallel. So that's very important for symmetry, and for, symmetry has been scientifically proven to be attractive to the human eye. So one of the things we're trying to accomplish when we do these types of treatments is to create balance and to create symmetry with the face. All right, so again, here's a close-up of the smile. This is the midline, so you can see the midline of the upper teeth kind of coincides with the midline of the lower teeth rather nicely. This is kind of the smile arc. So we want the edges of the upper teeth to follow the curvature of the lower lip. And this is something called the red proportion. So I'm sure you guys have heard of the golden proportion in nature. And, you know, when you're like a first year dental student, you kind of learn about the golden proportion in terms of teeth. But then, you know, more recently, I would say like, I don't know how many years ago, this red proportion, I believe it's called the recurring aesthetic dental proportion. This proportion has been proven to be, you know, more beautiful in terms of the ratio of the widths of the 6 anterior front teeth. So, you know, generally when people are talking about like the aesthetic zone, they're talking about like the front 6 teeth, mainly because these front 6 teeth are the anterior teeth. You know, one of the things that you learn as you kind of start to do more cases is that if you do just the front 6 teeth, it can sometimes look rather boxy. So, you know, one of the things that I learned when I was a 4th year student was, you know, these proportions are important, yes, but you know, you don't need to follow them in every single case because again, every single case is different. Every single person has a different face, so therefore every single person should have a different smile, right? So regarding doing just 6 teeth, I typically don't recommend patients do 6 teeth. If someone wants to do 6 teeth, I typically recommend they do 4 or 8 teeth because doing just 4 teeth can look natural and you can blend it in with the surrounding teeth. And if you do 8 teeth, then you're rounding that corner, right? So the canine is kind of the corner of the smile. So when you're rounding the corner of the smile, you can build out that premolar a little bit and really kind of create, you know, a nice natural looking smile arc without like just doing the front 6 teeth can look kind of boxy and kind of noticeable. If somebody smiles really wide, you can kind of tell that, you know, they have their teeth done, and that's something that, you know, you don't want someone to be able to like point out like, oh, you had your teeth done. You know, that's in my opinion, that's not the goal. So one of the first things we do after we mount the case is we do a diagnostic wax up. So as a dental student, this wax up, you know, I did this wax up when I was a dental student because you're a dental student, so you have to do everything. Nowadays, you know, the wax up is done by the dental laboratory, the technician. But it's good to know, it's good to learn all this stuff when you're in dental school so that you know how it's done. So the wax up is basically, you know, it's you build the teeth and the new contours and the shapes and the sizes with wax, and you mount it on an articulator, so you have a 3-dimensional basically model of how the patient's teeth come together. And on the articulator, you can check the bite and you can check the excursive movement of the teeth and make sure that, you know, this bite is going to fit this patient's teeth, this patient's envelope of function in a healthy, you know, non-restricted way. So these are the preparations. So the preparations basically consist of making, you know, making sure that there's no cavities in the teeth and reducing enough tooth structure so that there's enough space for the porcelain material to basically fit over them. Some cases require more reduction than others. And so one of the other things you can see in the preparation photo is at the gum line, there's a margin. So the margin is very important. And so when the dental technician is creating the porcelain restorations, they're looking at the margins like with a microscope. So they're looking at it like super close up, and they're basically building the porcelain so that it sits directly on the margin so that it's very flush. Because, you know, the majority of the reason why dental, you know, restorations fail is because of leakage at the margin. So it's very important that when we're bonding or when we're cementing porcelain restorations, that we have very perfect marginal fit, so that the tooth is basically sealed, so that there's no, you know, bacterial leakage. And so the provisionals are in the bottom picture. The provisionals are also known as the temporaries. So I don't really use the word provisionals when I'm talking to patients because, temporaries is just an easier term for them to understand. You kind of, when you're speaking to patients, you always want to talk to them in layman's terms. You don't want to be using these fancy language that they don't understand, because remember, these people didn't go to dental school. They're not dentists. So you want to make sure that you're speaking to them so they can understand. So provisionals, also known as temporaries, and the temporaries are very, very important, because not only do they allow the patient to test drive the new smile, but they give the patient an opportunity to, see how does this design look in their face? How do they like the size? How do they like the shape? How do they like, the curvatures and the different nuances of the teeth? So here's kind of a before and after with the temporaries. It's also a really great opportunity for you, the dentist, to make sure that you dial in the occlusion and get the bite to be really perfect, because that's obviously very important for the restorations to last a long time, is the engineering of the case, to make sure that the case is healthy in terms of the occlusion, the way the teeth come together. So here's the final porcelain on the model. These are kind of like some nice artistic photos that we like to take before delivering them. We kind of analyze them on the model, and here's them in the mouth. Here's a before and after retracted shot. Here's some before and after lateral shots. A before and after face shot, and then here's our patient talking. Let's see if we can.
Unfortunately, it doesn't seem to be picking up the audio, but if you want to just provide a brief summary of what the patient was saying.
Yeah, sorry.
No worries.
She was just very happy and kind of talking about how much she appreciated the work that we did at NYU.
Awesome.
So here's another really cool case. This was a case that I did in collaboration with periodontist. So multidisciplinary treatment planning, aesthetic crown lengthening, replacing old veneers with feldspathic crowns and veneers. So feldspathic is a type of porcelain, okay? So this patient had veneers done like a long time ago, and this is how she presented. She wasn't happy with the unevenness of her gums and her teeth. You can see from the smile shot, there's a lot going on. There's a big discrepancy in terms of, the gums and how they're not very symmetrical. It's, you can see some inflammation at the margin of her gums. There's a close-up shot. So this type of case, it requires what we call crown lengthening. Okay, so when we're looking to do, well, let me kind of back up for a second. So when I'm kind of explaining to the patient how I view the smile, I like to present it to them like this. So the teeth, the entire smile is kind of like a play, right? So the teeth are the main actors, the gums are kind of the backdrop, and then the lips are kind of like the curtain. So in order for the play to be, aesthetic, they all have to work together. So this particular patient, her gums or the backdrop of her smile are kind of the main issue here. And so anytime that we need to raise the gums to make them symmetrical this much, there's going to need to be osseous recontouring. Okay, so typically this is done by a periodontist or a gum specialist. And here's part of the functional assessment that we go through when we're treatment planning a patient like this. So she also has a very severe overbite. You can see how deep her bite is. So her upper front teeth are kind of touching the gums in front of her lower front teeth. So this is called a deep overbite. And for patients like this, they generally need to be restored. The vertical dimension of their bite typically needs to be opened. Okay, here's the wax up. And then here's kind of the surgery that was done by the periodontist, Dr. Chichiro. And so he basically used, from the wax up, as you can see, we corrected the margins of the teeth and the wax, the margins of the gum and the wax up, right? And then from that, we made a putty stent, basically a clear stent that then goes over the teeth and then basically guides the surgeon as to where he needs to position the gum tissue. So here's some of the incisions that he did, that this is kind of where he wants to bring the gums to. And then here's him flapping the gums up, and then under the gums is the bone. And then in order to create what we call biologic width, there needs to be adequate reduction of bone. Here's him reducing the bone again. And then here's him suturing it up, and the patient kind of has to heal. And then here's a picture of the preparations. We had to remove the veneers and place the temporary. So here's a picture of the temporaries at the bottom. Here's a photo of the final veneers or crowns on the model. And then here's what it looked like in the end in the mouth.
Wow.
Okay, so those are kind of two cases that I did while I was in dental school. That's not my Instagram anymore. I changed it to I changed my Instagram when I graduated to Dr. Matt Asaro. And that's not my email anymore. Sorry about that. But if anybody wants to reach out to me or ask me any questions, the best way to reach me is probably on Instagram. My Instagram is down here on the bottom right of this picture. But here's a case that I did recently for a patient, and this was a kind of a cool case I wanted to share with you because, there's always more than one way to do a case, right? So that's one of the reasons why, dentistry is considered to be practicing, because, dentists and doctors, we're still practicing at all times. So, you're constantly learning, you're constantly, there's constantly new technology and new materials and innovative new techniques that kind of can streamline or make our treatments less invasive or easier. And, a case like this, if you go to 10 different dentists, you're probably going to get 10 different, treatment plans in terms of what's the best way to tackle this case. So, typically a case like this is best completed by doing a round of orthodontics to basically straighten the teeth and get them into proper alignment. And then following the orthodontics, then, that allows you to basically do less invasive preparations. So some of those preparations you saw earlier of mine, those were like crown preparations. And crown preparations are becoming more and more rare these days. As adhesive technology gets better and better, we no longer have to drill the teeth into little nubs and have retentive features. We can reduce the bare minimum amount of tooth structure and then bond to the teeth. So this is kind of part of the rapidly evolving adhesive dentistry revolution, and it's interesting because even in dental school they still teach a lot of the old concepts. So it's not until like after you finish dental school and you start to really learn about the best gurus that are out there are teaching concepts that you just don't get exposed to in dental school. So it's something that you have to commit to being a lifelong learner, and that's one of the really awesome things about the profession is that you're constantly growing, you're constantly challenging yourself, and you're constantly looking for ways so that you can better treat your patients. Now, a case like this, the best way, like I said, is probably do orthodontics first. Straighten the teeth, get them into proper position, and then that allows you to do less invasive preparations. But you present all the options to the patient, and then at the end of the day, the patient has the autonomy to decide for them what they want to do. And for this particular patient, she's an older woman, and she wasn't willing to go through a round of orthodontics. So she wanted to fix her smile restoratively, and was made aware that tooth that's kind of sticking out in the front was going to need to be prepared rather aggressively in order to make the smile look right. And so that's kind of the way that we did this case, and it turned out really beautifully. And the patient has no post-operative pain. She didn't need to get any root canals, and she's extremely happy with her smile. So this is a case that was done recently that I just wanted to share with you guys. And here's my advice: prepare to be a lifelong learner. You really have to like people, and you really have to want to, constantly be learning and constantly be improving. So that's kind of the end of it here for you guys.
Awesome. Thank you so much for sharing a few of your cases and I guess your philosophy when it comes to treatment planning and your clinical approach. At this point, I'll hand it off to our chat moderator, Yoon, so we can address and touch on some of the questions that were asked in the chat.
Thank you for that awesome presentation. It was really amazing seeing how the smiles changed. But so the first question that we have is it a good idea to own a practice right after dental school?
Is it a good idea to own a practice right after dental school? It just depends. I personally think that it's not the best idea to own a practice immediately after dental school, because like I said, when you first finish dental school, you're by no means a fantastic dentist. Like the first year out of dental school, you're really you're improving on some of your speed and some of your efficiency, and you're still getting exposed to like some more difficult advanced cases. So, my personal opinion is that you shouldn't try to become a practice owner immediately out of school, but it depends. Like I basically did a 1-year residency program and then practiced for 2 years. So basically for me, I decided to become a practice owner 3 years out of dental school. And I'd say maybe 30 to 40% of my graduating class is already a practice owner 3 years out. Maybe 30%, something like that. There's still, I'd say the majority of people who aren't practice owners, but there's quite a few who are.
The next question that we have is, do you generally get paid during a GPR residency?
Yeah, you do. So you get paid like 50 to 60,000 for the year. So it's enough to live on. But one of the reasons I think some people don't do it is because you can come out of dental school your first year and start making well over 6 figures working in private practice, or you can basically make a third of that working at a GPR. And so I feel like that is some of the reason why some people don't do the GPR. But yeah, you do get paid, and you don't have to take any loans out for the GPR.
Next question that we have is, can you talk more about your experience as an associate dentist, such as lifestyle and hours?
Sure. So lifestyle was very carefree, mainly because as an associate dentist, you go into work in the morning, and then when you leave work, you're done. There's no studying at night unless you want to, of course. There's no administrative work. You don't have to deal with staff or payroll or marketing or anything like that. You go to work, you treat patients, and then you come home and you're done. And it was quite nice. Looking back, now that I'm a practice owner, I kind of miss being an associate because it was so much easier.
The next question that we have is, what are some pros and cons of attending NYU Dental?
Pros and cons. I would say the class size is probably the biggest pro and con, right? So the con is that there's so many kids. The pro is that there's so much opportunity. So whatever it is that you want to do, you can do at NYU. It's a massive research institute. There's some of the best, most world-renowned specialists teach there. There's just a lot of politics that goes on in dental schools, and I just know that NYU is one of the schools that they're able to get a lot of like sponsorship type situations with Colgate and all these different like corporations. So I think NYU has a lot to offer, and I think you can kind of find whatever it is you want at NYU, but again, you have to be proactive. So it's not going to come to you. So if you're the type of person who kind of just wants to skate by and kind of do the bare minimum, then, I would say maybe NYU isn't the best place for you just because it's so expensive. But if you, are really interested in, doing a certain specialty, or if you want to do research, then, NYU is fantastic because there's just so many people and so many different specialties at the school that you can seek mentorship from, and there's a ton of really cool global outreach programs that you can do at NYU that I did when I was there, which is where you kind of go to a third world country and perform dental treatment for people who don't have access to care. And yeah, there's just a lot of amazing things at NYU. The aesthetics program at NYU is very very fantastic. I know that when I was there, the NYU aesthetics program literally took like first, second, and third place at the national smile makeover competition, like for the past like 5 years. Dr. Calamia is like kind of one of the pioneers of porcelain veneers. And then, the NYU was kind of that program was where kind of Dr. Appa came from. And I'm sure you guys have seen Dr. Appa on Instagram if you look at dentists, but there's just a lot of really great people who have come from NYU. So, there's also a lot of really great, alumni and people that come back and lecture. So, living in New York City is awesome, and living in New York City also sucks. It just depends on the person. It depends on who you are and kind of, are you going to be able to focus in the city with all these noises and distractions? So I think you kind of have to, dig deep and think about who you are and what it is that you want out of dental school and go from there. But I would say kind of to everyone who has the opportunity to go to like a less expensive state school to probably pursue that. I think the price of dental school is just absolutely absurd. I think there's something seriously wrong with how much money it costs to get a dental education in our country. And I think the student loans is something that, you should strongly consider. Looking back, I kind of wish that I would have went to a state school and saved money. So that's just my take on it.
Just to sort of segue off of that question, for students, for pre-dents who are interested in cosmetics and aesthetics, how important would you say the school choice is?
It's tough to say. It's tough to say. I think going to a school like NYU definitely helped expose me to like this type of dentistry, because I remember I heard a lecture from Dr. Rosenthal, who's Dr. Appa's mentor, who, the aesthetics, there's a whole wing at NYU called Rosenthal Institute of Aesthetic Dentistry, and it's basically named after him. And I remember like hearing his lecture and just kind of being like, wow, like this is a cool part of dentistry that I never even really knew existed. So, I mean, I think if you go to, another school where there's not as much of like an emphasis on aesthetics, then you might not be exposed to it as much, and you might not have, the same type of mentorship. But that being said, you can really pursue aesthetic dentistry from anywhere. I mean, you don't have to go to NYU, like at this point, there's aesthetic clubs at most dental schools. I know at least like at all the dental schools like near NYU, like Columbia and Stony Brook and even Rutgers, they all have aesthetic clubs and programs. And really what matters most is the continuing education that you do after dental school. The way that you expose yourself to these cases after dental school is really what matters most.
Awesome.
I guess going off of that question, do you think NYU prepared you for the real world?
Yeah, I would say so. I mean, I know that the clinical experience, like the clinical experience is the most important part, in my opinion, of any dental school. So, the first 2 years are mostly didactic, and then the last 2 years are mostly, clinical, like working on patients. And that's really, in my opinion, what's the most important part of dental school. Obviously, like the didactic stuff is important, but you're going to get the same, you're going to get the same science no matter where you go. But the diverse patient pool that the students at NYU see compared to the students at, I don't know, like Kansas, or I don't know, maybe like Tennessee, or I'm just naming random schools in the country that just don't have as big of a patient pool, don't have as diverse of a patient pool. Like the emergency department at NYU, when you're a dental student, is an incredible experience. You literally, there's people coming off the street having dental emergencies every single day, and so you really kind of get thrown in there, and you really get a lot of great clinical experience. Like the amount of procedures that I did when I graduated at NYU was like way more than a lot of other students got to do at other dental schools. That's something I know, for a fact. That being said, I know that the amount of procedures that I did at NYU was a lot more than some of my classmates at NYU. It varies greatly, between different classmates. You kind of have to be proactive, and you have to go after the patients yourself when you're in dental school. So it definitely takes some grit and some hard work.
Thank you. I guess the next question is, do you have any tips for studying for the DAT?
Tips for studying for the DAT. I can only tell you guys kind of what worked for me, and that was taking a summer to dedicate to just studying. So I didn't do anything. I think it was the summer between my junior and senior year of college. I didn't work. I didn't do anything except for study. I literally would go to the library Monday through Friday for 8 hours a day. Take a lot of practice tests. I think taking practice tests was the most helpful for me, and then going over the test and seeing where you went wrong and what you got correct, I would say are the most important things. And get a good night's sleep and try to nail it on your first try, because it's kind of a thing. It's kind of annoying to have to do more than once.
So what was your hardest class in undergrad?
Me personally, my hardest class was probably physics, just because I was very good at organic chemistry. I was very good at biology, but for whatever reason, physics really gave me a hard time. So that was one that I had to really work at.
Next question is, can you please talk more about how you learned from Dr. Sam Sala?
Sam Saleh. Yeah. So I worked as an associate for Dr. Saleh here in Beverly Hills for about a year before I started my practice. And this was the type of opportunity that exposed me to working with an in-house ceramist, because he has his own lab in-house. So he kind of has a practice that's based solely on doing big cosmetic cases. And so when you're doing that on a daily basis, and at his practice, I was kind of doing a lot of the preparatory work, more of kind of like a glorified assistant in some ways. So numbing patients and removing temporaries, and doing like some of the basic restorative work. But it was a great experience to be able to work hand by hand with the technicians and learn a lot about that aspect of the procedures. And it was the type of opportunity that I'm very grateful for. And I think everyone should try to pursue mentorship. And mentorship is probably the most important thing that the most important thing that you can do to get where you want to go, right? So regardless of if you want to be a fantastic orthodontist, then find an orthodontist in your area who's 10, 15 years ahead of you, who's doing really well, who you look up to, and go talk to them and go have coffee with them and pick their brain and kind of ask them, oh, what was your path? What was your journey? You know, what are some of the things you wish you would have known if you could go back and do it again? How do you do this? And just watch them and learn from them, and kind of like success leaves clues, you know? So the best thing you can do is try to, you know, mimic some of the things that they've done to help them get to the point that they're at, and learn from them, and kind of, you know, I love the quote where it's, I forget it exactly, but it's like, if I've seen further, it is by standing on the shoulders of giants, right? So that's one of the things that allows, you know, the clinicians in dentistry to continue to pursue excellence and to reach new heights, is learning from the best above you, and then, you know, hopefully, you know, further improving. And then once you're up there, you know, putting the ladder down and pulling some other people up with you. So that's what it's all about. You know, that's why I'm doing this with you guys on a Saturday afternoon, because when I was in your shoes, I used to be like that annoying like dental student who would be like, oh, can I come to your office? Can I come shadow you? Can you, you know, like, I think that, you know, because I had mentors and I had people, I still have mentors. I have people who helped me. Like, I'm always going to want to like reach down and help others, because it's kind of like one of those oaths that you make to the profession. You know, you want to help the people who are coming up, just like people help you.
The next question is, how did you learn the business side of things to own your own practice?
Good
question. Yeah.
Very good question. So that's probably the hardest part of owning your own practice, is the business side of it, because, you know, a dental practice is a small business, and if it doesn't matter how good of a dentist you are, if you don't understand the business side of it, then you're in trouble. So the way that I've learned the business side is by, you know, a lot of it's been kind of learn as I go. And a lot of it's been through learning from mentors. And I'm also working with a management and training company who basically, you know, they teach communication, they teach sales. A lot of dentists don't like that word, sales. So I can kind of phrase it like this instead: facilitating treatment acceptance. So you can't do dentistry if your patient doesn't sign up for it, if your patient doesn't accept the treatment that you propose for them. And in order for someone to, you know, accept the treatment that you're proposing for them, they have to trust you, and they have to feel like they're in good hands with you. And so that's a vital part of the business. And then there's, you know, the numbers, the statistics, the you know, the collections and the production and the new patients. And there's a lot of different statistics that, you know, need to be tracked. And just like anything else, if one of your goals is to lose weight, then, you know, you're going to want to track your weight. And if you're trying to grow your practice, then you need to track specific, you know, parameters, specific statistics that show you how healthy your practice is. And unfortunately, you don't learn any of that in dental school. So, you know, there's a ton of resources out there. There's books, and there's courses, and you know, you have to learn it. You have to do it on your own. There's a lot of different consulting companies. The company that I work with, it's not really a consulting company. It's more of a management and training company. So they teach the dentist to be their own consultant. So they teach you how to, you know, not need a consultant. And a lot of it is based on psychology. So communication is a lot of communication is psychology. In order for somebody to accept treatment from you, they have to understand what it is that is wrong with them, right? And you can't really make something real to someone unless you're in communication with them, unless you have affinity for them, unless they have affinity for you. So you know, there's a lot that goes in to, you know, not just being a good dentist, but being somebody who's good at the business side. And so, you know, dentistry is a very difficult career. I'm not gonna lie. It's not all glorious. I'll tell you that. A lot of what you see on Instagram from all these different dentists is very it glorifies dentistry. You don't see all of the failures. You don't see all of the headaches and all of the difficult aspects that go into it. It's hard on your body. People are constantly telling you that they hate you, and they're not saying I hate you. They're just saying I hate the dentist. And it is what it is. And I mean, I don't like having needles and drills in my mouth either. So that's one of the things that makes dentistry difficult, but also kind of exciting, because we have the opportunity to change people's perspective. We have the opportunity to give them a good experience, to, show them and educate them on why oral health is so important.
Amazing.
Thank you for answering those questions. I think that's all the time we have for questions today. But yes, thank you for answering them.
Of course.
Yeah, that was, I think, a very fitting end to a wonderful presentation. Thank you so much, Dr. Asaro, for your time and for sharing some of your professional insight with us. That was awesome.
Of course. Yeah. Thank you so much, guys. And good luck to all of you. If any of you have any questions, reach out to me on Instagram. Just shoot me a message, and I promise I'll get back to you.
Absolutely. Great. And just before we conclude today's session, I want to remind today's viewers and today's attendees that the quiz will be posted in the chat, and it can also be found in our Instagram bio. And on that note, we want to thank everyone for attending, and we wish everyone a good evening.
All right. Thanks, guys.
Thank you so much again, Dr. Asaro.
Thank you.